Hi, I am Ariane from Richmond Foundation, and today I'm going to be talking about why it's important to get help on time. When we look at our mental health lies on a continuum, and it moves from being very positive, healthy functioning to severe impact on our everyday functioning. Now, each and every one of us lies on this continuum, and we move along it according to the different phases in our life. So there might be times when you might be experiencing very good and positive mental health. There might be times when you are somewhere in between, where you might be struggling with certain things, but still able to cope and manage overall. But then there might be other times when the struggles get bigger and you might be experiencing poor mental health. And towards the further part of the spectrum, we can also experience mental illness. So I'd like you to check in with yourself and ask yourself this question. How would you rate your mental health in these past few weeks? So with 1 being very positive to 10 being very poor mental health, when you look back at the past weeks, where would you rate yourself? This is a good exercise that you can do with yourself to check in occasionally with how you're feeling and where you feel that your mental health is lying. Because it's very important to address it if you realize that you are moving more towards poor mental health. If you notice that your struggles are becoming longer or more severe, then it might be a good time to seek help. You also need to remember that not all problems can be solved by yourself. We do have a tendency to want to solve our own problems or difficulties. We have a tendency to want to try to do things by ourselves. However, this means that we also delay seeking help until the problem becomes more severe or is actually beyond our control. Most problems which are left untreated will get worse or more severe over time. In fact, a build-up of stress, which is never addressed, can eventually lead to burnout. And this can also then eventually lead to depression. Most mental illnesses do not improve on their own, and if left untreated, a mental illness may get worse over time and may cause serious problems. For example, one might experience mild symptoms of depression, but when left untreated over time, this might develop into moderate depression and even severe depression. When it comes to mental health problems and help seeking, even though awareness on mental health problems has increased over the past years, even though we speak more openly about mental health and seeking help, most people who struggle with a mental health problem still do not seek professional help to this day and do not receive the necessary treatment. In fact, stigma is one of the main reasons why people struggle to seek professional help. Let's have a look at some barriers to help seeking. Sometimes people might refuse to seek help due to a lack of knowledge on how to identify symptoms of a mental health problem or a mental illness. So this might mean that the person is unaware of what a mental health problem consists of. They might not even notice the signs or notice that something is wrong. This can also lead to lack of awareness about how to access treatment. So you might not be aware of which services to access, for example, or which professionals can actually help. Feelings of denial, shame, and fear can also create a barrier to help seeking. The shame that might come through prejudice, or the fear of being judged, or even denial that there even is a problem in the first place. Sometimes it's also gender stereotypes that are related to seeking help, which might create a barrier. We know through research that men are less likely to seek help than women. Even the media can create negative stereotypes. So this creates a negative image in our mind that in order to seek help, I need to have a very severe problem, or that only people with severe mental illnesses need help. I might also be afraid of prejudice against mental illness. So you might also be afraid of seeking help due to prejudice, or also due to believing that the problem can be solved by yourself. However, stigma again does tend to take over in this regard as being one of the biggest barriers to help seeking. So what is stigma exactly? Let's take a closer look at this. Stigma is when someone views you in a negative way because you have a distinguishing characteristic that's either thought to be or actually is a disadvantage, what we can refer to as a negative stereotype. Why do persons with mental health difficulties tend to face stigma from society? Well, this is coming from many centuries ago, too. There has always been a problem with stigma in relation to mental illness. And there are various reasons, too. So some people might think that individuals with a mental illness are unpredictable or responsible for their illness, as though they brought the illness upon themselves. Some people might think that people with mental illnesses are incapable of rational thought or are dangerous. And these are very negative stereotypes and very unfortunate because they fuel stigma. They are not true facts or statements, but they are beliefs or stereotypes that have been created along the years. In fact, if we look at this quote, I will never understand why every organ in your body gets support and sympathy when it is ill, except for your brain. And yes, unfortunately, when it comes to the brain, we tend to forget that the brain is an organ just like any other organ in our body. So we are more likely to treat other problems related to different organs than to the brain. For some reason, we have this false idea that the brain can take care of itself, that the brain cannot get ill, that I am not meant to become ill in my brain, which of course is very untrue. Because as we know, a mental illness is also very biological, and it's actually the organ, the brain, that is unwell and that needs to be treated. In fact, we can look at some common stereotypes which continue to fuel this stigma around mental health and mental illness. Statements such as, people with a mental illness are dangerous and unpredictable. People with a mental illness are incompetent. People with a mental illness can never recover. Or it's the person's fault. Now, this is a common one where we tend to think that it's the person's fault. They need to do something about it. They are responsible for it. Or that psychiatric medication is for the weak. Again, these are very dangerous stereotypes, because if we do believe them, then we might think that seeking help or receiving medical treatment might make me weak. And this is not true, because actually seeking help is very brave. And it has nothing to do with being strong or weak. It's just that part of your body, your brain, your mind, needs to be treated because of a particular situation in your life. In fact, even certain articles that we come across in the media, newspapers, on social media, might also give us very wrong impression about mental health difficulties. They tend to create negative images, fuel derogatory language around mental illness, and also create a lot of sensationalism. Gender and seeking help is also, can also be a contributor to not seeking help. So for example, as we know, men are less likely than women to seek help for mental health issues and are much more likely to complete suicide. In fact, research shows that suicide rates among men are approximately 3 times higher than among women. And these high rates are often linked to traditional masculinity factors, such as not talking about feelings or being afraid to open up. Socially constructed gender norms, roles and attributes can even discourage men from recognizing and seeking help for mental health problems. The key sociocultural patterns to men's help seeking that pertain to masculinity norms were identified as self-reliance. So this idea that men need to be self-reliant and can handle problems on their own. A difficulty in expressing emotions. And again, this also comes from gender norms that have been set in place for a very long time. Self-control, this idea that if there's a problem, there also needs to be a sense of self-control. As a man might feel that they cannot break down, that they are not allowed to feel any emotions because they constantly need to have a sense of self-control. Another factor could be economic insecurity. So again, this idea, this notion of the man, for example, being the breadwinner or needing to be financially stable. And when a person is struggling with financial difficulties, this might make them feel ashamed to seek for help, to seek and ask for help. Also inequality, especially with marginalized groups, and also limited healthcare provision. So all these factors that are socio-cultural barriers might prevent men from actually seeking help. So how can we improve this notion of help seeking for men? There have been some successful interventions which have reframed the idea of help seeking as a strength rather than a weakness, or as a means of regaining a valuable attribute, such as being able to move from being dependent to being independent. What's interesting is that men who do not identify strongly with traditional masculinity are more likely to seek help in relation to mental health. So this means that the more we break down the gender stereotype of men, the more likely they're able to seek help and feel comfortable doing so. Also, changing the way media depicts what it means to be a man can be a successful intervention. For instance, by emphasizing the values of fatherhood or friendship, rather than aggressiveness or strength. This can also play an important role in helping society rethink masculinity. Now, what can you yourself do to reduce stigma? First and foremost, it's important to know the facts, to be able to distinguish the facts from the myths and the stereotypes. And once you know the facts about mental health and mental illness, you're more likely to be able to practice acceptance and respect. You're more likely to acknowledge that mental health problems are very common and that it can affect anyone around us, including ourselves. So another way would be to practice acceptance and respect both with ourselves and also with others around us, and to educate others, to be an advocate for mental health, to show that it is okay to seek help and that it is not shameful or nothing to be afraid of. So why is it important to get help on time? We've already seen that with certain problems, once they become bigger and once they become more severe, things can get worse. And from one problem, it can also create a ripple effect and cause other problems. So when we get help on time, we refer to this as early intervention. And it is very important to intervene as early as possible. Early intervention aims to prevent problems from becoming more serious. It also aims to reduce secondary effects. So as we know, one problem can develop into another problem. For example, in order to cope with depression or anxiety, a person might decide to resort to alcohol and substances in order to cope. So they might start off with one problem and they might develop a secondary problem as a result. So early intervention also aims to reduce these secondary effects. We also know that the longer the delay, the more difficult recovery can be. And support is extremely important here. So it's always very difficult to make the first step, to get help on time. It's always difficult to take that step, to reach out for help. So support from family, friends, colleagues, and those around us is very important and could be the push that we might need in order to seek help. There are also various treatments and supports that can help with any kind of problem, whether it's a mental health problem or even a general day-to-day problem. These could be medical treatments, psychological treatments, which involve therapy, complementary and lifestyle changes, such as exercise, a change in routine, a change in eating habits, for example. Support groups, where a person is likely to receive a lot of support from people who are going through the same experience. Rehabilitation programs, which are sometimes necessary for people struggling with a mental illness who might need support to get back to day-to-day functioning. And also family and friends. So when you are looking for different types of support, there are various supports that we can use, that we can implement or reach out to. In fact, there is no one-size-fits-all approach. We are all unique individuals. We all work in a different way. So we cannot say that one size fits all. What we do need to check is that individually we might need to ask ourselves, what kind of treatment might I need? Do I need to go to a doctor, for example, or might I need to see a therapist or a psychiatrist? So usually it's a combination of different treatments and support that is the best option. If we look at the professionals who can help, there are also various types of professionals depending on the need. So you might start off by visiting a GP or a family doctor. This is usually the first point of reference. Most people have easy access to a GP, and a GP is able to assess you, to look at your symptoms, and also to diagnose and to refer you to another professional if needs be. Psychologists can also be supportive. Psychologists, psychotherapists, and counselors. Now these all do what we call talk therapy. Okay? So whereas a doctor might refer you to a psychiatrist, for example, for medication, you could also be referred to a psychologist, a psychotherapist, or a counselor for talk therapy. They are different professions, but they all work in a similar way. Psychiatrists are doctors specialized in mental health, and psychiatrists are doctors who can prescribe medication, whereas psychologists, psychotherapists, and counselors do not prescribe medication. There are also social workers who can help in relation to social problems such as income and accommodation. Occupational therapists who can support you with day-to-day functioning. And also mental health nurses, which are usually found in clinics or hospitals and can support you in their own way. So let's take a closer look at understanding how therapy works. Most people do not fully understand what therapy means or what it entails. Most people might have a wrong idea about therapy. So let's look at the term psychotherapy. Psychotherapy is a type of talk therapy which can benefit people struggling with emotional difficulties, life challenges, and mental health concerns. Therapy can help improve symptoms of many mental health conditions, and in therapy people also learn to cope with symptoms that may not respond to treatment right away. When any type of mental health or emotional concern affects daily life and function, therapy may be recommended. Therapy can also help you learn about how you're feeling, why you might be feeling it, and how to cope with that feeling or how to cope with a particular situation. And therapy also provides a safe place to talk through life challenges such as breakups, grief, parenting difficulties, family struggles, or any other concerns. In fact, while medication can reduce some symptoms of mental health conditions, it's usually therapy that teaches people skills to address symptoms on their own. These skills can last even after therapy ends, and they may continue to improve, symptoms may continue to improve even throughout the years. Whatever you learn in therapy is usually taken with you throughout your life and can be implemented. And as I said earlier, a combination of therapy and medication is often recommended for most people. What's important about therapy is that a person who is willing to start needs to be willing to start out of their own free will. So therapy cannot be forced onto anyone. People who may feel forced into therapy may actually feel resistant and find it even harder to put in the work needed in order to make a change. So it's a very personal process, a very personal journey that one needs to make. So why are people so hesitant or resistant about going to therapy? There are many factors and many reasons why people might want to avoid going to therapy. First and foremost, there might be the fear of judgment or fear of the unknown. So without knowing what to expect in therapy, worrying that people might judge them for going to therapy, this can cause people to want to avoid therapy. There might also be doubt in the efficacy of therapy. So some people might ask, but what will therapy actually help me with? Why should I even go to therapy? What will it do? Some people might be misinformed about therapy. They might have an idea of therapy through media, which might not be depicted as it is performed in reality. So they might have a misinformed notion of therapy. A person may not understand the process of therapy and might be unsure about how the therapist will view them. They might fear that they will be judged by the therapist once they open up. There's also pride and distrust that can come into play here, feeling too proud to seek for help or feeling distrustful of the therapeutic process. Sometimes lack of insight is also the culprit, where a person might not be aware that there is the need for therapy, that there is the need to open up and seek help. This can also come about through limited awareness and not understanding what is going on within oneself. Unfortunately, sometimes people do have negative past experiences in therapy, and this one experience tends to remain quite strongly. So sometimes people are a bit hesitant about seeking therapy again because they might worry that the same thing will happen. However, it's important to realize that there are different therapists, different characters and people, and having one bad experience does not necessarily mean that this will happen again. That you might need to find the right therapist who will match with you. And then there are also some practical barriers, for example, not having easy access to a service, waiting lists, for example, or financial difficulties. These might also be reasons why people avoid therapy. So, when should I go to therapy? You can choose to go to therapy for various reasons. Some being when you have thoughts, emotions, or behaviors that are out of control, especially when these thoughts start to affect your relationships, your work, or your sense of well-being. So when you might feel very overwhelmed and feel that you cannot control your own emotions and behaviors. There might be times when you are struggling to deal with life's challenges, such as a major illness, the loss of a loved one, a divorce, or even job problems, work-related problems. There might be times when a problem is starting to affect or interfere with your daily functioning, and where day-to-day functioning is becoming a problem. Other times when you might feel confused and you need the perspective of a caring yet unbiased person to help sort among difficult choices. So sometimes having the perspective of a person who does not know you, who is not there to give their opinion or judgment but is there to be unbiased, this can also support you to help untangle certain issues. And another point when you might wonder about going to therapy is when you are seeking self-growth and self-development. And this could be a time where therapy might be very supportive in helping you to develop further. In fact, most people who are hesitant about starting therapy at first, once they do attend therapy and they find it to be an accepting and a safe place where they can open up at their own pace, people often then tend to find it the best thing that they've ever experienced. They might feel as though the growth, the comfort, and the ease that therapy has created opens them up to being a true version of themselves. Because therapy allows the person to open up, to untangle certain issues, to go through certain unfinished business that they might have still to deal with. And they might feel that it's supporting them to be a better version of themselves, or to find a version of themselves that they were unaware of before. So reaching out is important, and it is a brave thing to do. In fact, as the CEO of Richmond Foundation states, reaching out is part of taking charge of your well-being and doing what you can to stay healthy. Some final thoughts about seeking help. We do need to remember that none of us are superhuman. We all get tired, we all feel overwhelmed sometimes, especially when things don't go to plan. So if you do find that things are getting too much for you and you feel like you cannot cope or that you are feeling overwhelmed, do ask for help. Even if you are experiencing excessive stress at work, you may need to take a step back and reevaluate certain things. It may be time to review your working practice and to make some changes and some reasonable adjustments to your situation. You also need to remember that some problems cannot be solved without professional intervention. That we might want to ask for help through friends and family and colleagues as a first step, but then also acknowledge that some problems require professional intervention. Remember, you yourself are not a therapist, so you do need to seek help for your own difficulties. look after your own well-being and practice self-care, and remember to reach out for help. Thank you very much for watching, and I hope you have found this helpful.